For today, we are going to start talking about cognition.
Britt Phillips didn't grow up dreaming of being a nurse.
I always joke my high school counselor told me I had to pick something to do with my life, and she said this would be a good idea for me. And so I did.
That was 2 decades ago.
I truly love being a nurse.
She hasn't looked back, not even when most of us would have.
I was attacked, it was July 2015. I was working in night shift at a hospital.
Britt says she was helping a patient with a personality disorder at SSM Health St. Joseph Hospital in Wentzville.
I had to step in and prevent her from hurting herself. In the process of doing that, she managed to pick me up and throw me against the wall and against the floor several different times.
This cut on her back is from the impact with a TV.
When help did get there, she still was very combative and aggressive and threw me a couple more times.
Britt was out of work for a month recovering from her mostly internal injuries. She says the physical reminder of the attack hasn't gone away.
Definitely, I still feel it.
Her story isn't unique. 5 on Your Side found more than a dozen people in the St. Louis area criminally charged for attacking hospital staff just since June. Court documents show one patient at Barnes Jewish Hospital punched a nurse so hard that nurse fell backwards and cracked his skull on the floor. He didn't regain consciousness for 24 hours.
I think we're seeing it on the rise, not just here in St. Louis, but across the country.
Kathy Bonser is the Chief Nursing Officer for SSM Health St. Louis.
Why do you think the problem is growing?
Not only do we have just the burgeoning mental health crisis that is across our nation, but also the rampant opioid abuse.
The Bureau of Labor Statistics says a nurse was the victim in more than 80% of attacks by patients from 2012 to 2017. But that was 2 years ago.
Because we don't have any idea really how big the crisis is at all.
That's why the Missouri Nurses Association is working to get legislation passed that would require hospitals to document every incident.
And then the state would then report out those numbers.
SSM Health started tracking incidents of verbal and physical abuse in their facilities this year.
Just trying to understand what events took place that led up to this. So what can we learn and do differently to keep our employees safe?
At SSM Health St. Mary's Emergency Department, they've also installed signs to warn patients and visitors aggressive behavior will not be tolerated.
It's one of the fundamental aspects of my job, is to keep my employees safe.
They've increased the use of their metal detector, and they're part of a pilot program testing personal alarms for staff. All part of a new reality of danger on the job.
So if I'm staring you down and like walking you down, how do you feel right now?
Just so scared.
For Britt, it's personal.
They're going to become defensive and they might start lashing out.
Her mission is to teach the next generation of nurses how to protect themselves while helping others.
I don't see this issue resolving anytime soon. And so I want my students to have the tools that they need, no matter what setting they end up in, that they can keep themselves safe.